Hi, I'm Dr. Veronique Desaulniers, better known as Dr. V, and founder of breastcancerconqueror.com and the 7 Essential System. Welcome to our podcast of Wellness Warriors. So I'm so excited to have Dr. Jolene Brighten with us. She's a friend and a fellow colleague. She's a functional medicine naturopathic doctor and the founder of Rubus Health, a root cause women's medicine clinic where she specializes in the treatments of hormone disorders, including adrenal and thyroid conditions and autoimmune. But her specialty is being a leading expert in post-birth control syndrome. And we know with the thousands and thousands of women that have been on birth control pill for many, many years, this is such a great need. She thrives on navigating the space between conventional and alternative medicine. She's an avid researcher. She's written a beautiful book that she can tell us about. She's a best-selling author, speaker, certified yoga instructor, a mom. She does it all. And so I'm so happy to have her on our show. Thanks for being here, Jolene.
Thanks for having me. I'm really excited to dive on in, especially with you have an amazing community.
Oh, well, thanks. Yeah, we're definitely some interesting women from all kinds of backgrounds. So we're very excited to hear what you have to say about hormones and healing. So one thing that I've noticed with the women that we've coached, and we've coached women in over 39 countries so far, and we've seen a thread, and a lot of them have been on the birth control pill for many, many years, sometimes decades, which is really shocking. How many women really are on the birth control pill now? Do you have some statistics for us on that?
Yeah, well, it's actually startling. You know, when I started to look into it, it's actually, if you look at like the United States alone, it's about 11 million women who are currently using birth control. And it's about 100 million women worldwide. So we know that statistically speaking, about 80% plus of women have used birth control at some point in their life. So this is ubiquitous. There's a lot of us on it, and it's not all just because we don't want babies.
Right. And so what are some of the issues that happen when women take birth control pill for an extended period of time?
Yeah. So, the first thing to recognize is that if you were put on the pill or the patch or the IUD, any of these hormones, because you had symptoms like PCOS or acne, those kinds of things are left to fester. So whatever we've been masking is going to continue to fester because it's not being addressed. So that's one piece of it. And I do want to say, I'm not here to judge you. I did the pill for 10 years. And so, my mission is really just to support you where you're at. If you need to stay on it for whatever reason, I want to make sure that you're supported. And if you're ready to come off, we want to support you in that way as well. But, some big things that we should be aware of as women, and I really wish my doctor would have told me before I got on it, is that these pills, these patches, these IUDs, they all come with side effects. And some of the major side effects gets a little more airtime, like strokes and heart attacks, which, for the most part gets dismissed by conventional medicine. They're like, oh, it's so small. Things like breast cancer, depression, new onset of depression and anxiety has been correlated with using the birth control pill. And, a lot of this comes down to the fact that when you're using these hormones, they're disrupting your microbiome, they're wrecking your gut, so they can cause leaky gut, they're depleting nutrients, and, for however long you're on them, they're stopping your brain from talking to your ovaries, and that has an impact. Our entire hormonal system's like a spider web. You can't be strumming on estrogen and progesterone and not feel it throughout the whole system. And so we know that these hormones also have a really big impact on our adrenal and thyroid function, something that so many of us women deal with in the first place.
So somebody decides to stop the pill. Do the symptoms eventually just resolve and they get better on their own? Or what happens, post-pill, birth control pill?
Yeah, I wish every day I could say, yeah, you just stop and it all goes away. And that's really the story that we get when we get put on this is, I remember my doctor saying to me like, oh, you'll have no fertility issues. Everything will be fine. And then I went from a gal being a 28-day cycle until after I came off the pill, I had no period. And like, I went to my doctor, I'm like, wait a minute, you promised me this. And they're like, just wait, it'll come back. So no. And that's, that's the trouble is that, with these hormones, they have a really big impact on your body. Like they are so ubiquitous in our culture that we don't think twice about them. But think about it. This is a drug that has the ability to shut down your reproductive system, to mess with your brain and mess with your ovaries and everything else it's doing, there's going to be an impact throughout your body. And so what I see clinically is that if women don't take the steps to kind of undo the damage that was done while they were on them and while they come off of them, a lot of the symptoms that they have, so like depression is one that I don't see just going away just because you stop. Low libido doesn't just come back just because you stop these hormones. And so, to add an extra layer to that, there's post-birth control syndrome, which is, an array of symptoms. You can have all of them or a few of them, and they're pretty debilitating for women. And they can range from things like, starting to lose your hair, having cystic acne, to being infertile. And we can also see shifts in weight. And, honestly, like those things do not get better unless you actually put a little effort and attention. And I want to say, if your body is speaking out with these symptoms, it's because it loves you. It wants you to survive more than anything. And it's just asking that you pay attention and show it some love right back. And so this is something I help women, in my online program that we have geared, the birth control hormone reset. And I help women with clinically as well, is figuring out what is the diet, the lifestyle, and the supplementation that's best suited for them to really resolve these issues, whether they're on the hormones or they're coming off the hormones or they have been off of them. And, I see women who have been off birth control. So, as you were saying, I see women who've been on it for decades and then they come off of it and it's 7 years later, 12 years later, and the symptoms are still lingering. And it's because no one has gone in and said, let me troubleshoot that for you. And here's the exact interventions that you need. I've had to pour countless hours, and my family will definitely attest to the number of hours I've spent researching this, to be one of the first doctors to test and develop protocols clinically to support women with this condition.
And I love it because it's such a need. And with the women that we've worked with, the clients all over the world, we've seen that common thread where so many women have been on birth control pills. Now, statistically, what I've read, and I'm sure you're more on tune with that, but it can be as high as a 50% increase in causing breast cancer. What have you seen as far as a correlation there with birth control pills and breast cancer?
Yeah, so that actually is a great dovetail on what we were talking about things don't just go away. Mm-hmm. So we know that, birth control absolutely does increase the risk of breast cancer. And what the research is showing is that doesn't just go away just because you stop it. And that's something very different than, what we were told before. In addition, they came out with all these newer generation contraceptives, and, for the most part, they've done very little to iterate on improving contraceptive devices for women. But they came out with these newer generations to lower the amount of hormones. What I've seen clinically is, women are having less nausea, but we're not seeing less side effects. And recently, I don't know if you caught the study out of Denmark where they followed almost 2 million women. And they were aged 15 to 49. So I really wish I'm like a little broader would have been well, because when do we actually develop, I would say we don't necessarily develop breast cancer later in life as much as it gets found later in life, because that's when we start screenings. But, this was a study that showed us that yes, these newer generation contraceptives do increase the risk of breast cancer. And when we look at the number of cases, so they broke it down to like how many more cases would we see a year? And this is where I get really, really pissed off with medicine, because they were like, it's only 13 more cases a year. It's only 13 more cases per 100 women a year. Well, if you're in that number 13, do you feel like that's like something that your doctor shouldn't have told you? Right. It's something where I'm like, we need a true informed consent, and we do need transparency around this. And I think, why, so a lot of the birth control research gets dismissed because we don't take into account the individual, right? This was a medication made for a healthy person. Where are the studies looking at, well, what if you have risk factors for breast cancer? What if you have risk factors for depression? And looking at, now that we understand genetics so much more and the microbiota in the gut, there's all of these different things that really can come into play in a woman's life that well, your best friend may have done just fine on the pill. It completely wrecked you. You can't hold yourself to that same standard because we have these different variables. And this is something I know you advocate for, I advocate for. We need an individualized informed consent where we're having these conversations. And so with that in mind, we'll see these large variances where some studies say it's up to 50%, and some studies are saying, oh, it's much less. And they'll try to blame the environment and things like that. And it's true. So if you're living on like a Superfund site, so that's a super toxic area in America, you're going to have higher risk. Now, I personally feel like hormonal contraceptives are an environmental toxin. If you look at, like, we think about xenoestrogens, we look at these hormones. It's so silly to me too. I'm like, I popped that pill every day for 10 years and never even thought about that. But believe me, I was clearing out the plastic out of my house and not eating out of those containers. So, I just want to frame it in that way because it gets really confusing with the research. But you have to remember, these hormones were designed for a healthy population. They are not being studied in the context of the individual or the context of what are the other variables that can contribute, which is why the work that you do is so important, because you're talking to women about all of these things, your diet, your lifestyle, your mindset. I mean, all of these things that have an impact. And when we look at it, the pill is just one more drop in a bucket that's already overflowing.
Yeah, for sure. It's just that added stressor. So with all that being said, is there anything else that women can rely on that is safer as far as, birth control?
Yeah. So, it all depends on what's going on with your body. So when we talk about non-hormonal contraceptives, we have the IUD. There are people, I have a whole article on this. There are women who do not tolerate the copper IUD. Like if you have heavy, painful periods, it is not going to be your friend. Some women, there has been some studies showing copper toxicity. And so they've actually said, if you have a genetic predisposition to copper toxicity, you probably don't want this IUD. So again, it's back to that individualized informed consent. But something I teach every woman in my practice, whether or not they want to use it for birth control, is fertility awareness method. And these days, the fem tech is going off. So now we have things like Daisy and natural cycles, these things that use math to actually predict when we're fertile. And the reality is, you're only fertile about 5 to 6 days out of the month, which is why we're seeing newer generations of women jumping off of these hormones, because they're like, I mean, I don't know about you, in sex ed, nobody told me that. that didn't go down. So, fertility awareness method is a really powerful method. And when you use these electronic devices, so Daisy just published, they have a 99.4% efficacy rate.
Wow.
I know. Now listen to this. Typical use of the birth control pill is 91%. But we're all told it's 99. But guess what? Not everybody takes their pill every day at the same time. Some of us have malabsorption issues. You could have celiac disease, or you may have been binge drinking that weekend, because that happens when you're in college. Nobody's judging you. But there's all of these other variables that come into play. And when you look at the research of typical use, and my sister is one of those gals who got pregnant on the pill. She then, after her baby, went the fertility awareness route. I'm her big sister, the doctor. And at the time, I was like, you can't do that. That's not safe. Then you're going to get pregnant. 5 years, no pregnancy, decides that she's going to get pregnant that month. And I'm like, wait, what?
Wow.
And it was something after my son, I adopted the fertility awareness method. But why I teach it no matter what you want to do with contraceptive is because knowing your body is so valuable. And the data that you can collect by knowing yourself, there's no lab test and there's no doctor in the world who can access that. And this is something that medicine somehow forgot somewhere along the line, that the woman's story and individual experience is seriously significant data that can guide you and help you do better for her. And that's what we all want as doctors. We want to do better for our patients.
For sure, for sure. And it's interesting. I'd not heard about the Daisy method back in the day. Okay, my kids are in their late 30s. I use the basal temperature with the mucus and the calendar, marking my calendar with the little X and marking the temperature variations. So it worked, but it really made me in touch with my body. And to hear you talk about this technology sounds pretty fascinating.
It is really fascinating. And, it's actually in Europe, so in America, we're like, in the United States, they say, no, these devices are for fertility prediction so you can get pregnant. They're not a contraceptive device. But in Europe, they're being approved as contraceptive devices. They're way ahead of the times with us. And it's something where, I mean, there's really so much interesting technology coming out. So I was just interviewed for an international Italian magazine about a new product that's coming onto the market that actually thickens up the cervical mucus and makes it so that the sperm can't go. Let me back up. So when you have fertile cervical mucus, it makes a super highway for the sperm and they can get to that egg fast. It's beautiful if you want to have a baby, but what this product will do is it'll actually make that mucus a little bit thicker and make it so that the sperm has a harder time traveling. And what they're touting right now, I will, with the caveat, it hasn't been on the market long enough, but they're touting that it is a zero side effect. I would argue there is no zero side effect birth control, because one of those side effects is getting pregnant. That definitely happens. Right. But, it's something really interesting to see. And I will say, ladies, when things come onto the market, it's sometimes good to just let it sit there for 5 to 10 years and see what happens and see, what do women start reporting, because to frame the research studies, they cherry pick a population, bring them into a study, make sure that they're just who they want them to be. And if not, they kick them out so they can get their statistically significant results, because that's just how science works. And that's how you get funding. But you have to understand that when they do that, and then they try to make an inference about the general population, it doesn't translate so well. And so instead, really, when the real research trials begin is when they introduce it to the market and we see what happens in the next decade.
Got it.
That was such a tangent. Sorry.
No. I appreciate that. That's great information. It's good to know. So we'll digress a little bit to postmenopausal women, because a lot of the women in our audience are postmenopausal. And essential number 3 in the 7 essential system is to balance your energy. And one of those subtopics is hormone health and balancing your hormones properly. Now, if somebody is going through menopause and they've got the typical menopausal symptoms, are there certain foods that you can recommend, or even some supplementation that would help them make that transition a little bit easier?
Oh, totally. And I do want to say, because I think it's so important for your population, that so many women who have perimenopausal symptoms will be met with these hormonal contraceptives. That's a great disservice, because really, when you're making that transition, it's more about progesterone. Those synthetic things have progestin. That's what gives heart attacks and those kinds of things. We don't want any of that business. And at the same time, you're missing out on things like DHEA. Like, there's really important things that we need at this time of life. And so, as you're making that transition, I will hear doctors all the time say, just stay on these hormones until you stop having a period. Well, P.S., that period you're having is actually a pharmaceutical withdrawal bleed. It's not a real period. So I just want to say that, because I actually had a patient who was in her late 50s and she's like, I'm still having my period. And I'm like, you've been on the pill for how long? Like, let's bring you off of that. And so if I'm going to bring a woman off the pill, or she's coming into my practice because she's got perimenopausal or postmenopausal symptoms. So first things first, love your liver, love your adrenals, and you will never fail. So eating things like cruciferous vegetables, getting good B vitamins. So great sources of B vitamins can be like animal protein. If you're a vegan or vegetarian, you need to be mindful about your amino acids, because your liver doesn't detox without protein. So this always gets forgotten for some reason.
That's so true.
You have to have the protein. And so, in supporting liver health, this is something where diet does go a long way. Your liver is going to package up. So there's these little CYP genes, and they will package up and basically make your estrogen metabolites. And, we know that women with those high 16-OH or 4-OH estrogen metabolites, I haven't seen research where we can say that causes breast cancer, but we know women who have breast cancer, they typically have these higher metabolites. And it's because these metabolites, they stimulate growth. If you're a woman that before your period, your breasts are getting really large, that's a good sign that you probably have the wrong metabolites. But after your liver packages it up, your gut has to move it out. So take care of your liver, take care of your gut. So again, eating things like cruciferous vegetables, and for women with hypothyroid, they're always concerned because they've heard, like, don't eat cruciferous vegetables because of goitrogens. cook them. You're going to be fine. Like, I'm a woman with hypothyroidism and I eat a ridiculous amount of cruciferous vegetables, have not had an impact in that way. Also, getting in your leafy green vegetables, another great source of those B vitamins. And when we talk about liver, supplementation support, I like to look at things like DIM, which is what you get from cruciferous vegetables, but you cannot eat like 2 pounds of cruciferous vegetables. So that's why a supplement is a lot better.
Yeah.
N-acetylcysteine, which is a precursor to glutathione, or glutathione itself, which is like the mama of all antioxidants. You're going to protect all your cells. And, if PS, that glutathione is also going to help you detox, and your ovaries love it. Your ovaries love some glutathione. And then, the other things we start thinking about too is like supplement like calcium D-glucarate, because the bacteria in your gut, they can actually make beta-glucuronidase. And if there's too much of that, you're trying to clear out estrogen, it goes back into circulation. Hello, you're dealing with more estrogen than what you planned on. It drops. Now you have a hot flash. So that's using the calcium D-glucarate is a great way just to be like, let's just balance all of that out. We don't know what's going on in the gut, but let's give you that overall support. And then, if you are having symptoms like hot flashes, vaginal dryness, some of these, typical things that we see, bringing on adaptogenic herbs can be helpful. So once your ovaries quit, and they are meant to quit, your adrenals, those are never meant to quit. You fall back on those adrenals now for your hormone support. And the unfortunate thing is that in our society, and I can totally get on a soapbox with this, we use and abuse our women. We have them serve everyone and everything. And I can't even tell you how many times I have a woman in my office who's in her 50s who's like, I feel like I've lived my whole life for someone else, and I'm like feeling exhausted. Which, you have kids, I have a 5-year-old. I'm like, I can definitely see how that can happen. But at the same time, women don't really get support in this way. Like in our culture, I hate it, but we have an expiration date on our value. And that expiration is when you have wrinkles and you have gray hair and things along those lines. Things that in other cultures, they celebrate as a new kind of beauty.
It's silver hair, not gray.
I have gray hair. Your hair is gorgeous, by the way. I'm like, I hope to be rocking it like that for sure. But, in other cultures, they celebrate it. They honor this woman. There's been the matriarchy. And we have to stand back and understand that that's creating stress on your adrenals too. So it's not just about like, are you, skipping meals? So that's a big thing, is that you want to love your adrenals and transition easier. Do not skip meals. Do not start your day with a pot of black coffee. That's because if you stress those adrenals, they're going to kick out catecholamines. They're going to kick out cortisol. That's going to cause blood sugar dysregulation. It's also going to cause a hot flash. So it only makes things worse. So, definitely good blood sugar regulation, fat and healthy proteins at every meal. I was a gal that convinced myself I hated butter in my 20s. One of the stupidest things I've done. I was on the pill, not eating fat, and had zero libido. My 20s were not fun at all because of that. And it's something that, only after going into medical school and really into the research and understanding how hormones are made, I'm like, why are we telling women to be on a fat-free diet? That makes no sense. But, an anti-inflammatory fat diet, so we're not eating hydrogenated fats, trans fats, none of that stuff, but focusing on things like coconut oil, even having grass-fed tallow if that works for you, and bringing in like healthy oils through whole foods like nuts and seeds can provide, that can help you have the building blocks for really creating those hormones. Now, the last couple of things I want to say is your adrenals, they love B vitamins, they love vitamin C. Those things are really important. And vitamin C is like an unsung hero of the, vitamin world. So often people are like, that's just for your immune system. Go check out Linus Pauling's work. I remember I fell in love with his vitamin C research like decades ago. And, what we understand with vitamin C, it's protecting all of your cells. It helps with your progesterone levels. It helps with your adrenal function. It's an antioxidant. It does so many things in your body. So I could actually talk forever about menopausal symptoms, but I'm sure you got more questions for me.
Yeah, no, that's great. Great information. Now, what's your take on bioidentical hormones? Do you have an opinion on that? I'm sure you do.
Yeah. So, I actually use bioidentical hormones in my practice. I had a head injury a few years ago. I went on bioidentical progesterone, helped my brain tremendously. And I think they do have tremendous benefits. So we know that, once the ovaries stop, if we don't have enough estrogen and testosterone, ladies, you need testosterone. I don't know why doctors forget about this. They're like, testosterone's for men. No, it's also involved in your mood and your motivation and yes, your libido. But these hormones, when they get low, our brain atrophies, our heart starts to degrade in terms of overall cardiovascular health. Our bones are affected. And so I disagree with the stance of like, do such high dose bioidentical hormones that you still have a period. Like that's crazy. Like,
Right.
And also
right.
who wants to have a period for the rest of
Not
their
me.
life? Nobody wants that business. So,
Right.
but in my practice, I try to use the lowest, most effective dose of estrogen. The research is always changing. So I'm always going in and reading more about it. It's really important to understand that research studies will say progesterone causes this problem. And when you get into what they used, it was a progestin, a synthetic hormone, which we know causes tons of problems for women. But the other thing when we approach bioidentical hormones is that it can't just be all about estrogen and progesterone. We have to be looking at DHEA as well. That's an anti-aging hormone that begins its decline at 25. Some experts believe that's why we age in the first place. So we have to be looking at that because that has a big impact on women's brain health as well. And so, the other thing I like to tell women is, so in my practice, it's non-negotiable. We are doing lab testing every 3 months. I run Dutch panels at least once to twice a year to check their metabolites, make sure they're doing what they're supposed to be doing with those hormones. We teach them how to monitor their symptoms, and then we make sure that they are doing everything with the lifestyle practices that we know prevents things like breast cancer. And so that includes, I have a supplement that's called Balance, and every woman on bioidenticals is on this because it's comprehensive in making sure. I call it the sheepdog supplement in my practice because I'm like, it herds that estrogen into the right pathways and then helps you get it out of the body. But that's something that if you're on bioidenticals, you are exposing yourself to estrogen longer than you really were designed. And there are some theories with breast cancer and these other estrogen, sensitive cancers that it's the longer exposure that actually causes the problem for us. And so, I've seen, I've had women come into me on oral estrogen. That's a big no-no. Anytime you take something or you take estrogen by mouth, you increase your inflammation, your stroke, and your heart attack risk. And this is something that is not told to women that after age 35, that's much higher. So in my mind, if you put a 45-year-old on birth control pill, and you don't tell her about those risks and you don't test her first and then test her afterwards to make sure she doesn't have, increased inflammation, you can actually measure things in the blood and understand if she's actually building plaques in her heart. If you're not doing that, you're doing a great disservice to that woman. And in my mind, I really think women should, not every state allows this. I really think that women should have access to their own data and be able to order these labs themselves, because the reality is that not a lot of doctors are doing this. And it isn't because, well, some of them don't totally know that this is a good practice, but it's also something where they get stuck if they're an insurance provider, and they'll get in trouble if they're ordering excess labs and things like that. And so, it's important to know your doctor is not always the enemy. Sometimes there's things behind the scenes that are out of their control. But I do think doing your own monitoring while you're on these hormones is a really wise decision.
Absolutely, absolutely. And one thing that amazes me is that traditional doctors don't even look at the estrogen methylation pathways with women with breast cancer. And that's so critical because we know if they're not methylating or metabolizing estrogens properly, their risk for breast cancer is going to increase. So we have to support those pathways so that they're, getting rid of those aggressive estrogens.
Yeah. And also understanding that if you aren't methylating those things, it's not just affecting your estrogen. It's affecting your brain health and your mood. It's affecting so many systems in your body. And so I just want to frame it that way because I think it's also something that, conventionally they're so good at acute care. And if you got an emergency, definitely see them. And part of why they're so good at that is because they can get so myopic and so focused. And then they forget, oh, wait, but estrogen is actually affecting all of these other systems, or this hormone is affecting all these other systems. And it's just because they're not trained to think in that way. To me, I'm like, that's not a problem. Just don't go to your doctor, your traditional, or, whatever you want to call them, your medical doctor with a chronic disease case and expect them to understand all of these pieces. That's not what they're trained in. And that's not what they totally rock. Now, acute care, yes, love them for that. That's that. And I think that's a lot of time is how we get frustrated as patients, is that we bring our doctor, these complex problems, and they really weren't trained to think in that way. And we're like, hey, why aren't you giving me the solutions that I hear someone like me or you talking about?
Well, Dr. Jolene, I love your passion. I love your wealth of information, and you've given us so many great things to think about. So you're going to offer a free gift to our audience and our listeners. Can you tell us what that is?
Yeah, so we've got for you the Birth Control Quick Start Guide, and that is all the diet. Are you hearing that?
Oh, that's great. You're a mom.
I know. Somebody's interrupting me.
That's okay.
So
that's okay.
You have to give me a second, okay?
She's almost done.
Oh my goodness. Okay.
That's okay.
So we are offering the Birth Control Hormone Quick Start Guide that has all of the dietary stuff that can help your hormones get back on track, support you if you're on hormonal birth control pill, you're coming off of it, or you're just thinking, I got to get these hormones back into balance.
And so where can people go to find more information about you?
So you can find me on drbrighten.com. I'm also on Facebook and on Instagram, but be mindful. My name is Dr. Brighten, like the sun, DRBRIGHTEN.com.
Oh, I love it. Brighten. You brighten our day.
Well, thanks.
That's right. That's right. So, and we'll have all those links posted for our audience when we launch the podcast, and we'll give you ample notice before we get this on the public view. So thanks so much for your time, and enjoy the rest of your day with your son.
Thank you. Thank you for being so patient.
Oh, no worries. Bye-bye.
Bye.